for for a GP training programme in County Kildare. Deputy Martin Heydon, please.
I'll go to Ceann Comhairle, and I'd like to thank the Minister for taking this very important topical issue here today. Minister, I want to raise the need for a dedicated GP training programme for County Kildare. We have a great GP service in the county, but I am concerned that there is pressure already on our existing GPs in County Kildare, which is only going to get worse as the population of the county continues to grow and older GPs move towards retirement age. As you know, for somebody who wants to be a GP, they study 6 years of medicine, 1 year internship, and then the training programme itself dedicated for being a GP is another 4 years, 2 years based in a hospital and 2 in practice. There's no clearly defined area for Kildare at present, and this is a problem when it comes to then retention figures. The latest Irish Medical Council Workforce Intelligence reports show that County Kildare has only 41 GPs per 100,000 of population. This is the 5th lowest in the country and well below the national and international average, the national average being 51 per 100,000. Up to 25% of Kildare GPs are predicted to retire in the coming decade. This is very concerning and has implications for patients, practices and an already overstretched out of our services if these GPs aren't replaced and even more recruited. Kildare is one of the largest growing population centres in the country, Minister, as you'll be aware, with an increase of 5.6% in the 2016 census, the 3rd largest growth nationally after Fingal and Meath. That's an extra 11,800 people living in Kildare since 2011. It is estimated that every 2,500 growth in population in County Kildare creates the need for a new GP. That would equate to a need for almost 5 new GPs in the past 5 years while retaining all that we had. The Programme for Partnership Government emphasised the need to focus on enhancing primary health care services, including build-up GP capacity, increasing the number of therapists and other health professionals in primary care. In order to do this, as well as investing in primary care centres, we need to ensure that we can attract and retain more young doctors to work as GPs, and I want to specifically ensure that Kildare has a sufficient supply. We are very lucky in Kildare to have 20 GP trainers operated in the county, who are spread among a variety of schemes: Midlands, Midlands NACE, RCSI, TCD, UCD. But I think it's the spread across different schemes that really is the crux of the issue here. Because the problem is, while these programmes get all of the benefits of the Kildare GP community and the KDOC out of our services, Kildare itself isn't retaining enough graduates to meet future demand. Internationally, it has been shown that the presence of a local and identifiable GP training programme is an effective way to do this. County Donegal is a very good example, and an area that, because of geographics, you would imagine it would be harder for them to retain GPs after training than it would be in somewhere like County Kildare. Yet they are in excess of the national average for GPs to population because they have their own identifiable training scheme. During recent presentations on the future of healthcare, Professor Susan Smith said that one of the solutions to retention of GPs in Ireland is providing targeted GP training in areas where GPs are needed. I would like to see a GP training programme of our own in County Kildare to help retain GPs for Kildare, Minister. I believe that the skills and infrastructure are already in place, so there should not be a significant additional cost for this measure. I understand a reorganisation of GP training is proposed for 2018, when the Irish College of General Practitioners will take over from the HSE. For Kildare, I see this as an opportunity for us to have our own training programme, and we would welcome your support in this regard. This programme would have the support of the majority of Kildare GPs and existing GP trainers, and would also be a very significant benefit to Naas General Hospital, that would benefit from having those trainees during the 2 years of the hospital placement also. And Minister, just to put into context the kind of pressure that our GP service is under at present, our KDOC services are dealing with 60,000 clients a year. It's a phenomenal figure that really shows the kind of level of work that's going on there in the services already. But we need to be able to maintain our numbers and grow our numbers, because our population is growing and will continue to grow, and you know, the age profile of the GPs is heading in the other direction.
Minister, you have 4 minutes to respond.
Ceann Comhairle, first of all, I want to thank Deputy Martin Heydon for raising this very, very important issue, and I want to commend your work and interest, particularly on GP training, and also particularly in relation to your views and support for developing our GP services and in general our National Health Service. At the outset, I would like to assure deputies that the Government is committed to ensuring that patients all over Ireland continue to have access to GP services, especially in remote rural areas and also in disadvantaged or socially deprived areas. Several efforts have been undertaken in recent years to ensure that the general practice remains an attractive and rewarding career option, and to attract more GPs into the workforce, and these include, changes to the entry provisions to the GMS scheme to accommodate flexible shared GP contracts, and the extension of the retirement age for GPs under the GMS scheme to 72 years of age, an increase in the annual number of GP training places, the introduction of an enhanced support package for rural GP practices. In addition, proposals are being developed to introduce supports for GPs working in areas of social deprivation as part of the GP contracts review process. A mapping exercise is currently underway which will inform the setting of eligibility criteria and the actual content of the support framework. The GP contracts review process will, inter alia, seek to introduce further measures aimed at making general practice an attractive, fulfilling and rewarding career option in the future. GPs are essential to the provision of accessible services to patients in the most appropriate setting. Increasing demands on the health system will have a major impact on the future need for GPs. The HSE's National Doctors Training and Planning Unit is working on developing detailed workforce plans for different medical specialities. Its report on the future of demand for general practitioners 2015 to 2025 found that there is an undersupply of GPs, and I accept Deputy Martin's point there. Medical workforce planning for general practice has therefore been prioritised in this context. The HSE and the Irish College of General Practitioners announced earlier this year that they had reached general agreement on the future of delivery of the national programme of specialist GP training by the college. This is an important change in the way GP training is delivered and funded, and will ensure that we build more training capacity and at the same time maintain the high quality of training required of all of our GPs. The annual GP training intake was increased from 157 to 172 this year. This is an increase of 53 places from 2010, when GP training places stood at only 119. This further step is crucial to ensure the capacity for GPs and primary care to take on additional responsibilities, including greater GP care coverage and the management of chronic diseases within the community rather than in the hospital. The Programme for Partnership Government also recognises the need to build GP capacity and commits to increasing the number of GP training places over the next 5 years to 259 places annually. GP training programmes delivered by 14 separate GP training programmes throughout the country and are not designed along county boundaries. While County Kildare does not have its own dedicated GP training programme, there are several GP trainees based in the GP trainer practices in County Kildare. These trainees are principally aligned to the Midlands and Trinity training programmes, with 14 in the Midlands programme and 4 in the Trinity programme, a total of 18. Finally, the Department will continue to work closely with the HSE and the Irish College of General Practitioners to ensure that the general public can continue to have a ready access to GP services and that doctors have access to GP training opportunities.
Thank you very much, Minister.
Thank you.
Heydon, you have 2 minutes.
I'd like to thank Ceann Corlett. I'd like to thank the Minister for his response there. And in particular, I welcome the increase in the amount of training places that the Minister has outlined, and also the agreement between the HSE and the Irish College of General Practitioners announced earlier this year that they have reached general agreement on the future delivery of the National Programme of Specialist GP Training by the College. That's a positive. And really what I want to take out of this debate here today, Minister, on the floor of this House, is an acknowledgement that the demographics of Kildare, with such a young population that we have, but a population that is due to age in the coming years and that is consistently growing, there will be greater demand on GP services into the future, that there is an ageing profile to our present GP services, and that there is a problem in Kildare with retention of the trainees that we are putting through the system. So we have 20 trainers, GPs around the county doing great work, but we're not retaining enough of them in the county. And what any GP in Kildare wants at present is to know that when they retire, there will be somebody else to take their place, to care for their patients at the level and consistency that they've done to date. And, you know, if you take a rural area like Castledermot that reaches from the Wicklow border all the way over to Athy, places like Athy Town, Newbridge, Kilcullen, and everywhere in between, that you know, where patients themselves are concerned as well about this into the future, and a lot of families, the GP is the first port of call when anybody needs that health service. KDOC is doing a fantastic job out of hours. As I said, when it comes to 60,000 clients last year, it's a phenomenal and one of the most successful out of hour services in the country. But our GP services, now is the time for us to plan adequately for the future. And I would hope that that consideration will be taken as part of the realignment with the National College of General Practitioners into the future. And I would ask you, through your good offices, to make that point back to them also.
Thank you, Deputy Minister.
First of all, I want to thank and welcome and accept Deputy Martin Heydon's point there on the pressure in our GP services. And that is something that we have to try and catch up on. We've had a number of difficult years over the last 7 or 8 years where there hasn't been enough investment in our health services. And of course I take at that point. But in the programme for government, we intend to rebuild and invest in our health services. And as part of that development, increasing our GPs will be a major part of that strategy, because it does play a major role in community medical services, but it also assists the pressures in relation to our A&Es and our hospitals as well. As I said earlier on as well, the whole development of the GP services are not designed on county boundaries. But that doesn't mean that counties, and Deputy Martin Heydon's point that he doesn't have genuine concerns, and he has real concerns in relation to these issues. When he talked about Castledermot, Newbridge and Kilcullen, of course I will bring that view back to Minister Harris, because I think it's essential. If there are gaps in GP services within individual counties, like in your case, Kildare, these have to be dealt with and accepted. And I will give a commitment today in the House that I will bring back that strong message to Minister Harris, because I would be very, very strongly supportive myself in relation to developing GP services, whether it's in Kildare or in other counties. We said earlier on we've prioritised disadvantaged areas, and that's another day's work, another issue. But in relation to today's topical issues, I just, again, finally, Cancorla, I give a commitment that I'll do my best to expand and develop the GP services.
Thank you very much, Minister.